excited.
We couldn't wait. We couldn't wait.
Special guest. And first of all, who are we?
Well, I'm Renee.
This is Renee.
That's Jim.
And I'm Jim. And we are Jerry and admin at the Tripawds forums and blogs at tripawds.com. And first off the bat, we want to hope you're all safe.
Yeah. And not going too stir crazy.
But we want you to remain socially engaged during this time of physical distancing. So we know that's real important. If you're stuck at home alone, it's more important than ever to reach out to others that understand what you're going through. And you'll find that in the forums and blogs and live chat and toll-free helpline at tripawds.com. This is a newsletter week, so we have all sorts of stuff going on in the news blog and nutrition blog and gear blog and foundation blog.
But the biggest news we have, other than today's special guest, is
Tripawds founders, Jim and Renee, are going to host their first live video conference. So this is a free webinar where if you're new to Tripawds, if you're facing amputation, if you just got a diagnosis, or if you're in the first few weeks after recovery and feeling lost and alone, we want you to know you're not alone. And we have plenty of tips and advice for you on recovery and care and how to stay sane during this crazy journey you're now going down with all of us.
And just to let you know, we are not vets, but we can be there to offer the emotional support when you have fears and worries and you know, you're concerned that your tripod's not going to make it through recovery because they're having some trouble pooping or something like that.
And for going on 13 years now, we've interviewed numerous vets, rehab specialists like our special guest today, certified orthopedic surgeons, rehab technicians, etc. So this live webinar is going to be Tuesday, 1 week from today.
The 21st?
The 21st of April. And you got to register so we can send you the link to view this and engage with us and get some live Q&A. And that is at tripawds.com/facts. Facts.
F-A-C-T-S?
Yes, facts. Tripawds.com/facts will be a Pet Amputation Facts live webinar on Tuesday, the 21st. So we hope you'll head over there, register for that. We'll send you the link. You're also going to get a free ebook download and a few videos from vets we've interviewed over the years. So check out tripawds.com/facts and tune in next Tuesday with the link we send you.
Week from today. And just want to say thanks to everybody for the nice words over there. Michelle, Tanya, Raylene, Marie, Jeanette, you guys are awesome.
Thank you for joining. Again, we're Jim and Renee, Tripawds founders, and we have our first live webinar next Tuesday at tripawds.com/facts. That's going to be noon on Tuesday, the 21st. But this is
today's a very special Tripawd Tuesday.
This is Tripawds Tuesday Live, and we started a bit early because we have a very special guest with us today. This is Spokesdog Wyatt Ray's very own
orthopedic veterinarian that he sees when we are in Colorado.
Please welcome Dr. Teresa Wendland from Colorado State University.
Yay, Dr. Wendland! All right, I'm going to
make some room here.
It is so good to have you here. Thank you so much. I can't believe it took us this long to have you come on Tripawds, because Wyatt's been seeing you for what, like 4 years now?
Yeah, close to 4 years, I think.
Yeah, and you know, your guidance with him has made such a difference in his quality of life that we're just so grateful. Tell everybody a little bit about yourself real quick.
Sure. Thank you so much for having me. It means a lot to me. I've really enjoyed being a part of your group, and I love being part of Wyatt's team. So it means a lot to me to be included in this too. So I'm Teresa Wendland. I am currently a third-year sports medicine and rehabilitation resident at Colorado State University, and I work in our orthopedic medicine and mobility department. So what we are doing is essentially all of the initial diagnosis in orthopedic patients who are not necessarily clear-cut headed towards surgery. And then we work hand in hand with a physical therapist to develop rehab and physical therapy programs for our patients to basically help them go from time of diagnosis to through long-term management of chronic orthopedic disease, or to try to get them through the healing process in non-surgical injuries, or direct patients to surgery if that's what we feel is needed. So that's kind of what I do. If you're wondering what resident means, so it means that I went through vet school, I did a specialty internship, And that was about a year long. And now I'm about 3 years into my specialty training in orthopedics and rehab.
Wow. I wish every tripod, every dog out there could have the kind of quality of care that you provide. And as a team, the OMM team there, we were on a consult call with you last week about Wyatt's case, and it was amazing. I mean, just to have the 4 of you there thinking about his needs and his pain management and what we can do to keep him going strong at 11 years old. I feel like we struck gold with you guys, and it's my dream that every new tripod has this kind of care. Now, you are no stranger to tripods because you are a tripod mom to a very special dog. Can you tell us about her?
Sure. So my current tripod is Eileen. She is a 2-year-old female spayed. I'm giving you a listing like I'm doing a case in a veterinary patient. My apologies. But she is an Australian Shepherd Poodle mix, so an Aussie Doodle. She was rescued by a very dear friend of mine down in Arkansas. She was result of a breeding project gone kind of wrong, and they couldn't really find a home for her. So my friend took her on actually at 4 days old and has been working with me to try to get her to use her little leg. So she was born with a partial limb. It's this kind of small limb, so none of her bones actually form normally, and she's missing everything from the wrist down. And so you can see her little prosthetic there. So she can't fully straighten her elbow because of that deformity. So that prosthetic was specially designed for her to try to give her a little bit of limb length extension and to try to give her that 4th leg to stand on. So she has been with me since she was about 18 weeks old. She has a little bit of an issue with her hips, but overall now she's doing great. And so I made a temporary prosthetic for her while she was growing so that she could learn how to actually pattern her gait with it, so she could learn how to actually walk like a quadruped. But she does great as a tripod too. And so we really kind of just split the time depending on how much time I have and what she's doing. She's got some skin allergies, so we can't always put her prosthetic on. Yeah, so she's my little tripod baby right now. And her tripod predecessor in my home was a greyhound who unfortunately lost his battle with osteosarcoma, but he was my first tripod. So do you want anything else on Eileen?
Yeah. So Eileen, now she is pretty much a case study because she was literally part of a study, or is part of a study, isn't she? A few years ago, you started working on the prosthetic study at CSU.
Yeah, we actually didn't include Eileen in the study because we figured I'd be pretty biased. So
that makes sense. Yeah.
I don't think that her data would actually be very useful for us, but she's very useful for me as a doctor living with a tripod who has a prosthetic limb, because I know what it is to live day to day with that in my home. And so her, and now I've had a couple fosters as well. So I've been through that process personally. We do have a study though, and we have 2 still ongoing. I did a retrospective study that's actually published right now. So that is available, actually, I believe, to the general public. Cool. That was looking at surveys of owners who have had dogs with a prosthetic limb for at least a year. Some people actually have had them up to 10 years in that study, and just basically what their experiences are. So looking at functional outcomes, meaning how well does that dog use the prosthetic for tasks other than just walking. So do they run with it? Do they jump with it? Do they dig? Can they lift another leg to go pee and stand on the prosthetic? So different things like that. And also just owner satisfaction and experiences with it. So was it a positive experience, a negative experience, or somewhere in between? And so for that one, the long story short is overall people were pretty happy with it. But there were a lot of difficulties along the way. So we reported a number of what we called complications, just minor skin sores, problems with fit. It's a little hard to fully understand the scope of all of that when we're not directly involved with those patients, since it was retrospective, meaning looking back at old cases, not and then including that data instead of following it as it's happening, which would be more of a prospective study. So we did follow that, and I'm actually just doing the final edits on a prospective study right now, and I'm sure that's probably what you're referring to.
Yeah. Now, I did not know about that first study, and I would love to share that with the community. So when we go offline, we'll talk about a link and all that, and I'll see if we have access to it, because I would love to share that information.
Yeah.
Were those in the retrospective study? Were those animals from all over the country, or were they CSU patients at one point?
So they were all patients of orthopets. So orthopets is the orthotic and prosthetic companies that we work with, since they're based out of Denver. And they shared their database with us for owners who had agreed for follow-up communication to maybe be included in research. And so we reached out to owners of those pets via email, and we sent them a survey and collected medical records where we could, and then created that study from the data that those owners were able to provide for us.
Oh, nice. That is really cool. We love orthopets. Yay.
Yeah, and they were from all over the country. So that was the other really cool part. They weren't just CSU patients. And I can get into this more, but it's hard because sometimes you have a doctor who's used to working with prosthetics, and then you have way more out there who probably aren't used to it. And so everyone's experience is a little different if you don't have that support team either. So I think it was a really great place to start.
Yeah, absolutely. And that's one of the first things people ask about when they join Tripawds. Is my dog a candidate? And I'm like, well, it would really pay to talk to a vet who is really familiar with prosthetics. I mean, somebody who's done it a lot like you, and just can prepare you for what to expect if your dog is a good candidate. So tell me about the prospective study now, because that is really exciting to us.
Yeah, it's really exciting to me too. It's been a long time in the making, so I can't wait to actually get that information out there. So with that study, we were able to basically enroll any dog who was who had a problem with the leg that we were recommending an amputation for, where that problem, so whether it be a defect, cancer, injury, was below a certain point on the limb. The reason being is right now, prosthetic limbs in dogs are fairly limited in where we're able to attach them. So the recommendations from most orthotist, prosthetist companies, especially orthopets who we're working with primarily, is that we want to retain at least 50% of the radius and ulna, so 50% of the forearm, or around 50% up to maybe a third of the tibia and fibula, so the shin bone in the back leg. There is a company that is doing some total limb amputee prosthetics for the front end right now. And it's a little bit more of like a support rather than like a true prosthesis where they're able to independently move that limb. So we kind of looked at that as a different thing. And that's kind of why we wanted to keep to this criteria of lower limb amputees. So most of our patients had problems up to the end of that radius, so that distal end of the radius here. So any dog could be included if we recommended amputation for their problem and they had that lower defect. And then we track them for at least a year, when possible, to just see what did that process look like. So how did we perform that surgery? What was the most common level of amputation we were performing? What were the problems that cropped up that maybe we weren't aware of before, since those haven't really been published on extensively? What did that fitting process look like? So how did we fit them? When did we fit them? What got us to that point in time? And then when did they first start using that leg successfully? And were they able to walk as a quadruped on that prosthetic limb? we ended up only deciding to publish on about 6 months of that data. There were a number of dogs who were enrolled that had cancer. And unfortunately, we did lose a number of patients to cancer, not because of local spread, but just because of systemic spread due to the nature of the kinds of cancer that can affect those patients. And then just a few, I had a foster dog who we included who moved out of the state. And so some of it was follow-up as well. But we have about 6 months of really solid data with some follow-up x-rays, complications, things like that. So that should hopefully be published pretty soon. But I will put it out there that we actually were able to get every one of those dogs to walk as a quadruped at some point. Two of them ended up discontinuing prosthetic use for different reasons. One, just he was in a foster scenario that didn't work out. And just with their home situation and then subsequent adoption, they discontinued use of the prosthetic since follow-up was impossible. Another one, just he had a lot of problems keeping the prosthetic on his leg. And he was one where we did a pretty high amputation. So we really cheated that 50% radius ulna. And it became a frustration for that family. And they just felt like it wasn't positive for his quality of life or their quality of life to keep trying with the degree of frustration. And so, but they were very happy that they had elected a partial amputation because they noted that he was sitting, using his leg really functionally. He actually would still hold a bone with his little, we call it residual limb, but you can call it his stump. And he would use it to sit sternally. So I'm sure a lot of you who have forelimb amputees know that sometimes they can end up on that side and we have a little bit of a Humpty Dumpty situation where they have a hard time righting themselves. And so with this patient, it was really nice for him because he was still able to sit up in a Sphinx position.
Is that unusual for that to happen? Because we've had quite a few members through the years whose dogs had a partial, and it became such a problem because the dog was banging it up so much, and it just they ended up doing a full amputation later on.
You know, and I personally, and I've only seen so many that have come through CSU, but I've personally never run into that as a long-term issue, at least with our post-operative patients. So I think there's a difference though, because I have seen a few patients where they had either a congenital deformity where they were missing the end of that limb, and there was some abnormality at the end of it, or a scenario I've run into a couple times is where the dam will chew off the paw of a puppy because it's stuck in the placenta or umbilicus or some other reason like that. And so they've had a traumatic amputation of that leg. And in those cases, I tend to see poorer tissue coverage of that leg. They often have callus formation, but they can get what I'm assuming is nerve entrapment in that callus just from the pain or discomfort that I've seen, or where they have abnormal or sharp bone in that area. And so those are the patients where sometimes that callus gets knocked off of the limb, it may bleed, it's painful. And in those cases, we really do sometimes consider things like revision surgery, whether that be continuing with a partial limb to try a prosthetic solution or converting to total limb amputation.
Okay.
And that's just my experience. I'm not discounting anything that's happened with a surgical amputation that's had problems.
Oh, sure. So can you tell us what was the biggest finding, the most exciting part of the study that you discovered when it was over?
Oh boy. I think one of the most exciting things for me is how well the dogs with distal limb amputations did. The ones who were lower than that 50% radius and ulna, every single one of them walked. Every single one of them at some point used that prosthetic very successfully. Even the one who doesn't use his prosthesis, they put like a little covering on his leg and he actually runs around as a quadruped. And so that's pretty cool. And so I think it just gives us one more option. You know, I think for years, people have been fighting the idea of partial limb amputation because we just don't know. And I think that there have been some bad outcomes if, you know, for one reason or another, and whether that is difficulty with follow-up, lack of experience, particular patient or owner factors, you know, I think there's a lot contributing. But the fact that there is another option out there, and now we're starting to get some data that it's valid. And I think people have known that for years, but especially I think on the specialist side, there's been a lot of pushback on that until we gain a little bit more of objective data.
Well, we can't thank you enough for doing that study, because it helps us help people out there to know what their options are before the animal loses a leg, because too many times they come to us when it was just a paw problem, and maybe the paw needed to be amputated, but they took the whole leg. And now we hear those stories and we're like, oh my God, you know, it's too bad I couldn't talk to somebody.
And, you know, I also want to make people aware too, it's not for every pet. It's not for every owner. There is a lot more work that goes into at least the front end of that process. And so, you know, I don't want anybody who's been through that to feel bad either. Because I do think that, you know, especially depending on the problem, a limb amputation is so much better of an option than what we could be putting that dog through. And I think doing a prosthetic takes a lot of time, a lot of commitment, and it's an expensive option too, because you're looking at the surgery, you're looking at a prosthetic, and truly rehab needs to be a part of that. You know, and what I'm seeing in my patients and what I'm hearing from other patients, the data we collected from the retrospective study, dogs who used it more frequently and had follow-up rehab care just seem to do better. And so again, it's not a solution for everyone, but it is a possibility, and it is a possibility that allows them to remain a quadruped so that they can move more biomechanically correctly.
Yeah. Well, we learned so much from you, and one of the things we want to switch gears now and talk about. Where'd she go?
We lost Dr. Wendland.
Oh no, our connection or something happened. Dr. Wendland, if you're still there, click on the link and come back. And in the meantime, I'll let everybody know one of the things we want to talk about with her is what are her top 3 bits of advice? That there she is. We got her back. Yay! There she is. Here she comes. The doctor is in. Yay!
Sorry, I don't know what happened.
Bad connection. Probably us. Oh no. Oh.
So that means something on her end.
Okay, so wow, I thought it was our connection. Everybody, I think maybe the BeLive app is crashing from so many people using it right now. We'll get her back, and she's trying again. Here we go. Ready, 2, 1. Okay, all right, cross the fingers.
All right, perfect. I somehow ended up with 2 screens open, and I was getting feedback. So
okay. Ooh, that must have been nasty. Sorry about that.
No worries.
So we were gonna switch gears now, and we have about 10 minutes left. So in your experience, what would you say are the top 3 things that any tripod parent should know?
Yeah, I think that's hard. Top 3. I apologize if I throw out more than 3. I might throw out more than 3.
Oh, please. Yeah, thank you.
I think so. Looking at early on in the process, I think it's really important to have appropriate pain management. I think we tend to, as a veterinary profession, actually downplay our patient's experience with discomfort after surgery. And we know in humans, it's a very traumatic process. We're lucky with our veterinary patients that they don't seem to have the same psychological trauma that people do when they lose a limb. They cope amazingly well. In my experience, if they have issues after surgery, there's usually a medical reason for it, less so that depression. We can usually find a reason stemming from pain, lack of real mobility, other systemic disease, things that are impacting that quality of life. And I think that pain management plays a big part in that. So pain management. After that post-operative period, especially if they have other orthopedic or neurologic disease that can cause discomfort, continuing to make sure that they are managed appropriately is really important for getting them moving and I think keeping up that quality of life. Part of that, so again, talking about mobility, keeping a lean body condition. So that is huge, especially as a tripod ages. So in humans, we have proven that people, when they lose part of a limb, do gain weight. There are a lot of trends that have been tracked, and we don't have any data to support that in dogs, but I've seen a very similar trend. And especially when we feel bad for our pets, I think we tend to shower them with love, which can be in the form of treats. And that's probably one of the worst things we can do for them, unfortunately. Whenever I see an orthopedic patient, whether they're tripod or not, I always recommend keeping them a pretty lean body condition score, meaning I actually want to be able to see their back couple ribs, if they're a fluffy dog, to really be able to feel them. Dogs, even bulldogs, even English labs, even those boxy type breeds should have a tucked waist and should have a waist profile that you can see from the tops and the sides. The reason being, it significantly reduces the force on their joints. And now we take away a leg and we're putting even more force through that remaining limb. We know that extra adipose tissue also contributes to inflammation. So keeping that excess adipose tissue down helps to decrease systemic inflammation that can contribute to arthritic conditions. So that's probably my number one when we're not dealing with the immediate post-operative period, because that helps with mobility, it helps with stamina, and it helps with pain management. And then I think number three is just knowing that they have slightly different needs when it comes to exercise routines. So, you know, if your average pet who doesn't have orthopedic disease, and I'll throw cats in here too. I don't mean to keep talking about just dogs. I know we have plenty of tripod kitties. You know, but for our average dog, we just kind of take them for walks, play ball, do their things, and they can go on and lead a great quality of life with excellent mobility. We can take them for hikes and not worry about it. But I think we just need a little bit more maintenance for our disabled pets. For both dogs and cats, coming up with some kind of a home routine. So not saying you have to go see your rehab practitioner every week, but maybe starting a program and building on that program initially so that you have a daily exercise routine, just like us doing, you know, core exercises, going to the gym, going for a little jog. That maintenance just becomes a little bit more for our tripods. And that's so that, say with a hind limb amputee, we want to make sure that they can stabilize their pelvis and that they can support themselves without sinking their weight down on that back leg. On a front limb amputee, they really pull themselves forward with their necks and their backs, and they can get a lot of muscular dysfunction and discomfort from that motion. We want to make sure that we're maintaining appropriate mobility for those patients and make sure that they're able to appropriately compensate and maintain that mobility too. So, you know, I'm always amazed, but we can get them doing little one-arm push-ups. You know, very few of us can do that. They can do that, but that helps to make sure that they can continue to flex that limb all the way up and they're not just getting really tight in their triceps and shoulders. So things that we can do to actively maintain that mobility and strength and stamina throughout their lives is extremely important, in my opinion.
I couldn't agree with you more. And you have taught us so much with Wyatt. I mean, Jim and I didn't know anything about appropriate exercise when we had Jerry, our first front leg amputee tripod. And back then we used to let him play Frisbee. And now I see those photos and I just cringe because I know what we were doing to him. But can you explain from your perspective and your experience what harder activities like Frisbee and chuck it throwing and things like that can do to a tripod?
Sure. And I think it's something to be aware of, and it's not something that we need to necessarily exclude from the lives of every tripod, but just being aware of the way that it really does change for those guys. So we do have some studies that actually do track the way that dogs move when they have a forelimb or a hind limb amputation. A couple of those studies actually came out of CSU. But so, for example, for a forelimb amputee, what we see is that they will shift that leg over so that they can use it as a tripod. And that changes the angle of the shoulder. It changes the angle of the elbow and then the wrist. And they have to find my screen there. There we go. Opposite. They have to angle differently. And so that limb alignment is different. And now we put excessive force through that limb. And now there's also stopping and digging in with that single front limb at an abnormal angle. And so we can be opening up ourselves for other problems like carpal hyperextension injuries, collateral ligament injuries, since they're putting more stress on this medial collateral ligament. We can be putting more stress through that shoulder as well, since they have to do what we call abduction of that limb. So they're constantly engaging that pectoral muscle. They're constantly engaging the muscle on the inside of the scapula called the subscapularis, and they're kind of stretching out some of these other muscles. So we may be opening ourselves up for some shoulder injuries there. With a hind limb amputee, again, they have to move that limb underneath them. So that hip is being pushed more towards the outside of that hip socket. So if there's already pre-existing hip dysplasia, that can be a contributing factor. The knee, they have to put a lot more force through that collateral ligament as well. And it may open them up to other injuries there. And then again, the angulation of that ankle. And so we're just putting that limb under more stress than a dog who has all four legs, and they do have to just change the way they move. So knowing that if we're doing these repetitive motions and hard stops and hard turns, that we could be opening them up to injuries, especially if they're not conditioned to performing those exercises and motions.
Yeah, the conditioning part is so important. I mean, I know some tripods, like Bart the Vizsla, he was a hunting dog, and that Vizsla, oh my God. Yeah, he could go on a hunt for 5 miles and come back with energy to spare all the way up through his later years. But not every dog is capable of doing that, depending on the kind of condition they were in when they had the amputation, correct?
Right. So I think being aware, you know, sometimes we have, especially like I said, these older dogs, they come in and they're not conditioned, and then we amputate their leg, and now they're expending so much more energy to be an amputee. And even our very fit dogs, you know, they go from being able to move more normally and use their body functionally, and now they have to readapt to come up with that new function. Again, you know, referring to people, research shows that people with an amputation expend a huge amount of energy in comparison to dogs, or I'm sorry, people who have 2 legs. And the higher the amputation, the more energy they're expending. So it's not a direct translation to dogs since they're quadrupeds. But if we're looking at most of our tripods being true total limb amputees, then that energy expenditure probably does go up for those patients as well. And we see that as they're getting used to that new normal.
I have your wondering appointment on the line, and he's...
Sorry about that, work calls.
It's great timing.
So we see that, you know, that they're panting a lot more. They get more tired. They can't go for walks for as long. And so working up slowly, doing shorter but more frequent periods of activity are great ways to build that up. Even just with our general arthritic or geriatric patients who aren't used to activity, doing that, just even going to the end of the driveway, but getting up and doing that 5 times a day, then doing it halfway down the block, going to the end of the block, going a couple blocks, and we can build up to that slowly, plus coming up with that exercise routine. For tripods, core strength is huge. So working on core strengthening exercises, and that will help actually improve their endurance and mobility, since they have to accordion their spines out of it too. I don't know if they answered the question. I feel like I'm rambling now, but
no, this is great. Thank you. I don't want to keep your appointment waiting. So,
that one actually is not mine. That one is for Sasha.
So we don't have to rush. But anyways, good. Well, you know, when you saw Wyatt last year, I just want to let everybody out there know that even Jim and I, we're not perfect tripod parents. And you gave us a real wake-up call when you told us that Wyatt needed to lose weight. And I was like, what? Myself? Really? And it came as such a shock because we are so conscientious about his weight, but you saw what we didn't see because we see him every day. And I just want people to know that it's a constant management when you have a tripod. I would say that's the one thing as a pet parent that kind of changes your relationship with your dog is you become even closer to them, or your cat. And I'm sorry about not mentioning cats too much, but you really need to keep tabs especially hard on their weight and their activity, and being able to consult with somebody like you even once a year, if that's all that you can do, is so helpful. I mean, Jim and I are only in Colorado a couple of times a year to see you, but in the meantime, you know, we get this kind of guidance that is just priceless. And now we have an 11-year-old tripod who, you know, it's taken a toll. He's been a tripod for 11 years, but thanks to maintaining a relationship with CSU and the OMM team there, he's doing so much better than a lot of other dogs I've seen at his age who've been lifetime tripods. So we can't thank you enough for that.
Oh, well, thank you. And you're not giving yourselves enough credit. You are excellent tripod parents. And Wyatt's maintenance and mobility is a lot better than 11-year-old quadruped patients that I have in some cases. So I know that's hard to see, especially when, you know, a dog who was so athletic and, you know, doing so well starts to age, but you guys are really doing a good job. But, you know, Jim and Renee put in so much work. They are always doing exercises. They are following up constantly. They really are putting in the time and the energy and the work. And Wyatt is doing phenomenally for an 11-year-old tripod with, I won't go into his list, but a lot of orthopedic.
A lot. And when you mentioned pain management earlier, I thought of Wyatt because he is on a lot of pain management. He's on a cocktail of different medications right now. And a lot of people see that as a bad thing. You know, I don't want my dog to be on pain pills because we tend to associate it with the addiction problems that humans have. But the medications that you have prescribed to Wyatt the last few years, I know have helped with his quality of life. So I would just like to end this with, if you could speak to people about ongoing pain management for a tripod once they're past recovery phase. What is your best advice for that?
Yeah, so I think it depends a lot on the dog. There are some dogs who don't necessarily need pharmaceutical pain management, especially young tripods who otherwise don't have other orthopedic disease. And so we can look at pain management from a number of directions. There are physical modalities. So there's acupuncture, there's massage, there's therapeutic exercise. Mobility really promotes a lack of lessened pain. And we know that the receptors in joints actually respond to motion, and motion can help decrease pain. For those that aren't as lucky, who maybe do have issues with their spine or issues with their other joints, I think we need to look at, you know, what is a safe and effective way to treat that pain. We know that the most effective medications that we have for treating joint-associated pain from arthritis, or say even soft tissue injuries, not including the nervous system, are non-steroidal anti-inflammatories. And that includes a group of basically, well, like Remedil or Carprofen is our probably most common one out there. There's a new medication, Galliprant, that works a little bit farther down the pathway, Previcox, etc. Those are ones that definitely help with pain. They can be used long-term. We just need to track. So blood work, making sure that your dog or cat is systemically healthy. Cats are a little bit trickier with NSAIDs just because cats seem to be so predisposed to kidney disease. And we want to make sure that we're not using too much of that. But those tend to be some of my first line of defense medications. And they are also nice because they can be used on an as-needed basis. So they work immediately and pretty effectively. For chronic pain management cases, we also look at medications that attack wind-up pain. So if they've been in a pain state for a long period of time, that's we want to consider some of these other medications that come from different pathways. Or if a patient cannot be on a nonsteroidal anti-inflammatory for one reason or another, what combinations can we use that are also going to treat that pain effectively? And then as they get older and have multitudes of issues, going at their pain management from what we call a multimodal approach. So treating different pain pathways, incorporating physical therapy, incorporating physical modalities like massage and acupuncture as well, can be ways that we can do that. So gabapentin is a common medication, amantadine. We don't tend to use a lot of opioids in dogs just because we don't want to be using them for chronic pain management. Tramadol doesn't actually work very well as an opioid in dogs. It can be part of a pain management approach because it does work on some other pathways as well. But that's also a nice thing because they don't form physical dependencies to that drug in the way that people can. So also muscle relaxers. So those ones are, and Wyatt's been on them for a number of years because they get compensatory changes in their muscles. So especially if we're having a hard time with rehab or we need them to be a little bit looser, a little bit more mobile, we can use muscle relaxers also on an as needed basis or for a period of time to get them through a rough patch, or on a more long-term basis if they're having problems with muscle spasms. So it gets to be a lot, and I know drugs can be a little scary, but if you are keeping track of things, if you're communicating with your veterinarian about how your dog is doing, you know, maybe they seem really tired on this one, what else can we try? There are a number of medications that are very safe for long-term use. And then there are also ways that we can manage the pain without medications. Like I said, you know, going through programs for exercise, using laser therapy, transcutaneous electrical neurostimulation, so TENS units, the little pads that you can put on the neck and cause little pulses. Yeah, and so you can treat individual muscle spasms, and you can also put it on either side of the spine, and it can treat the muscles along the spine, but it also modulates pain through that spinal cord. So different methods like that you can even do at home can be really helpful for pain management.
Man, we need to have you back because that is a whole discussion we could spend an hour on. Thank you for that information.
Yeah.
It's awesome. Yeah. So I want to thank you for being here, and we'd love to have you back someday.
For sure.
Yeah. Thank you so much. And we'll keep in touch. You know, we will.
Great. Well, thank you so much. I really appreciate you including me here, and I'd love to come back and we can break down some of these topics, and then in the future too, maybe we can even do some little tripod exercises with Eileen or something like that. So you just let me know what you want to do.
Yes, that would be fantastic. I will take you up on that. We're not shy. So thank you.
Sounds good. All right.
Thank you.
Once again, thank you so much, Dr. Wendland. And we will take you up on that. We will have you back. And speaking of that, what is happening next Tuesday?
We are having our live Tripawd
Pet Amputation Facts, a live webinar, video conference with
Tuesday.
Tripawds founders, Jim and Renee. We're going to give you the best tips for recovery and care, as well as how to remain sane during this difficult time. So if you're new to Tripawds, or if you are just facing an amputation, a diagnosis, or coping with recovery, you definitely want to tune in. Sign up at tripawds.com/facts. We'll throw that in the comments here. The link is above if you scroll. And there will be a Q&A. So if you have your own experience that you want to share with the community, you're more than welcome to sign up for it too, even if your tripod is long past recovery. So reserve your seat at tripawds.com/facts. This is happening on Tuesday, April 21st at 12 noon Pacific, 3 o'clock Eastern, because 3 is a magic number. And we will answer questions. And if you do sign up, you're going to get a free ebook download, and you're also going to get a series of videos with vet interviews we've done over the years offering their best tips. So I think on that note, we're going to send you to tripawds.com/subscribe, because this is a newsletter week, and there's all sorts of other things going on in the blogs and forums that we didn't talk about.
Yeah, have a great week, you guys, and stay strong, and please stay healthy, and we will get through this pandemic. Thanks so much, Dr. Wendland. Everybody, have a great day.
Speaking of that, real quick, the pandemic stuff
never ends.
It's so important to remain socially engaged during this time of physical distancing. You may be alone out there, you may be going crazy, and we are here to help in the live chat, discussion forums, toll-free helpline. Check out tripawds.com/start to find it all. We hope to see you soon, and we will definitely see you next Tuesday. Tripawds.com/facts to sign up for that webinar. Thank you.